everybody. Welcome to Preventive Cardiology and Rehabilitation series. My name is Khushboo. I'm a cardiac rehab specialist in Aster CMI. In today's episode, we are going to dive deep into very misunderstood but very common heart health challenge, which is hypertension. So joining me today is Dr. Ganesh Nallur, an interventional cardiologist from Aster CMI Hospital, who will help us today to simplify the science behind hypertension. Welcome, sir, to our series.
Thank you.
So my first question to you, sir, is that we see many patients who are coming with 120/80 BP. My BP is absolutely fine, and they are still ending up afterwards into hypertension or any kidney related issues and all of that. So do you see that one BP works for all, one reading works for all, or it's gonna be different for everybody?
That's an excellent question, Khushboo. So when we look at the hypertension as a diagnosis, just one reading of BP of 180 or by 120/80 or 130/85, that's not going to give you an answer. BP will range depending on the age. As we age, our normal BP only sort of goes up gradually, and especially there is also a variation during the day as well in terms of the BP. So just one reading wouldn't help, and to make a diagnosis we have to take multiple readings at different times of the day, and only based on that we can make a final decision about whether this patient has hypertension. These patients who have probably been missed are the ones who had just one reading and they think everything is normal and carry on. Hypertension is called as a silent killer because of this, because in the initial stages you don't get any symptoms, and only on the BP readings you can make out the diagnosis. So they come after 3-4 years with kidney disease or heart disease. So it's very important that we just not rely on one reading.
So we also see, sir, that when in rehab patients are coming early morning, their BP is quite high, but the same patient who are coming in the afternoon, their BP readings are fine. So BP also follows the circadian rhythm, right?
Yeah, absolutely. So within the circadian rhythm, what happens is our body calls cortisol and adrenaline, they increase early in the morning. That is because when we wake up, basically you have to be more energetic and the body is getting ready to wake up and start doing things. Unfortunately, in patients with either stress or smoking or bad sleep and all these situations, the circadian rhythm can worsen in that the BP can be very high in the morning because of all these other factors. And hence, we also see that strokes or heart attacks are more common because the BP shoots up and then you end up with a stroke or a heart attack early in the morning. So it's very important to look at this and then see that early morning BP is controlled in all our patients when we are treating them.
And also, sir, many a time we see that when the patient is going to the doctor's office, their BP is coming every time normal, and many a time we have seen that the BP or this high BP or hypertension issues are getting missed. So what will be your take on that? How can we diagnose hypertension early and safely to tell that this is a hypertensive case and then go forward from
See,
there?
this is a very important issue that you have raised now. Two things can happen. One is that the BP can be normal or that the BP can be very high in a patient who is normal. That is called as white coat hypertension. To diagnose either of them, what we need is something called as a 24-hour ABPM, which is basically ambulatory blood pressure monitoring. It monitors the BP throughout the day. So during the day and the night. So as we have discussed already about the circadian rhythm, there should be a dip in the blood pressure about 10 to 20% in the night and a slight rise early in the morning. So all these things are taken into account, and only a ABPM reading can help us confirmly diagnose about the hypertension. There are other tests that we do to look at indirect ways like an ECG or echocardiogram to see if there is any secondary effect from the blood pressure, and that can also give us clues about the hypertension.
So is there anything else which can cause the hypertension, or it's always about heart?
No. See, there are lots of secondary causes that can cause hypertension, especially kidney disease. Like you can have kidney vascular, what we call as blood vessel of the kidneys can cause problems, or hormonal changes. Specific hormones are there which can cause hypertension. And one very important aspect is pregnancy. So we call it as pregnancy-induced hypertension or preeclampsia. So people who have had hypertension during pregnancy, they are at higher risk of developing hypertension early. So they need to keep an eye on their blood pressure. They shouldn't feel that post delivery, if their BP is normal, that they're not going to get hypertension. So they need to keep an eye on that. So there are various causes, and we always look at these secondary causes, especially in young patients when they come with suspected hypertension, whether that is causing it. So unless you treat the secondary cause, you're not going to help the patient.
Correct. And even like once the patient is hypertensive and on medication, many a time we have seen that patients stop the medications by looking at their BP, that I have seen the multiple times and my BP is absolutely fine now. So can you explain us how dangerous it can be?
Yeah, see, that can be very, very dangerous because blood pressure, unfortunately like diabetes, is a long-term disease and we have to manage it. It can't be cured as such completely. So it's not like your fever where you take medicines for 2-3 days and it goes away and you stop your medicine. So with the hypertension, when the hypertension is on, the BP is controlled with the medications, what you need to do is ensure that you continue the medicines, because if you stop it, then you'll have rebound hypertension. They can present with arrhythmias, they can present with heart failure. I'm sure you might have seen in your rehab as well that there are issues if patients stop them. Have you noticed any specific symptoms?
Yes, sir. Like many a time with this happens that they either reduce their dosage or they just stop the medication, and they come with either very uncontrolled BP where it shoots up during the exercise a lot, or they have palpitation, arrhythmia on the ECG and all of that. So yeah, it is a dangerous thing.
See, patient compliance is very important, and nobody likes to take medicines, especially if they're on 2-3 medicines. So it's very important when we see them in the OPD to counsel them that we shouldn't stop your medicines, but we can try and reduce the dosages based on how well your blood pressure gets controlled, and that has to be done in a very graded manner and under supervision. So all those things we have to really counsel them well and make them understand about that.
Correct. And whenever anybody want to manage their hypertension, apart from the medicine part, they also start doing the exercises, and I feel like you can help me out in this, that many a time patients are starting like a walk, high intensity exercises and things like that. So do you think that is one of the reason why so many gym collapses are happening nowadays?
See, that could be one of the reasons. See, one of the things, as it comes back to the same point of patients not wanting to take medicines. So you tell them, BP is very high, you start medicines, and then they'll say, no sir, I'll hit the gym, I'll do exercises, I'll lose weight, I'll stop all salt. And then the first thing they do is take a gym membership and then start running vigorously. So because they want to do it very fast, because the doctor has told that the BP is quite high. So that can be very dangerous. So what is important is a supervised exercise based on various parameters. I'm sure you will be able to tell me more about that aspect. And medicines are also very important. So basically what we say is exercise is important and it will help, but unsupervised exercise is bad.
Yeah, that's why we in rehab we try to have like a continuous feedback where their heart rate and their ECG and BP, everything is continuously monitored, so we can personalize the protocol even in middle of the exercise session, and maybe adding flexibility training, meditation and all of those type of thing will also help to fasten this process rather than just doing the aerobic or resistance training in that.
Yeah, absolutely. That aspect that you told about personalizing each person's exercise regime is very important. It's not like one size fits all. So it's very important to tailor it, and it has to be, it's not like any normal person going to a gym. So somebody is hypertensive, we say it's important, but it has to be personalized.
Correct. And many a time exercise and diet is another aspect which comes in mind. People think that when I'm hypertensive, if I will stop my salts and manage my salts, then everything will be fine. So do you think salt is that bigger a villain?
No, see, salt is an important aspect of managing hypertension. We say 4 to 6 grams of sodium is what you have to take. But what people don't know is it's not easy to measure. People will have various different kinds of salt they take. and a lot of times they use this pink salt and rock salt, and they feel that just by taking rock salt they can take how much ever they want. Obviously it is slightly better than the refined salt, but it doesn't mean that you can take how much ever you want. So again, all this has to be tailored well and looked at well, and take the help of your dietitian to help you support in that. So there are other minerals that you have to manage, like potassium, magnesium. So all these things, a balanced diet is important. I think a dietitian would help you really in that.
Yes, sir. That's why we even when the patient is coming to rehab, we tell them that it's not just your salts, but you try to manage your sleep better. Nowadays, alcohol is one of the biggest issue in this, that people are drinking very often. So that is one of the thing which we ask them, how can they do in moderation, or how can they manage that well. And also we speak about refined carbs, refined sugar, how they can reduce it. So yes, as you told, that it's a holistic approach which we have to take. Only salt might not help into this.
Absolutely.
So the last but very commonly asked question, sir, that my parents had an hypertension, and that's why I will have an hypertension, and I can't do anything much about it. So what is your take on this? Is that really true, or you can still manage it?
See, when we talk about essential hypertension, which is the normal blood pressure that most people get, it is sort of multifactorial, and genetic can play a part. So if your parents have had it, especially at the age at which your parents got it, you might also get it. But that doesn't mean that you should just leave it to nature and say, okay, I'm going to get it and I need to go on tablets. So you can always make your personalized changes to your lifestyle. Make sure your eating habits are good. Make sure you reduce the salt intake, reduce the refined sugars, and as Dr. Khushboo has mentioned already, alcohol is an important component. Unfortunately, alcohol has become a very common, not only in men but also in women. Okay. It's become common, and you tend to get dehydrated, and the following day you end up eating quite a lot after you've had a party with alcohol. So all these have a major impact, and by altering your lifestyle, ensuring regular exercises, which is personalized and which is well under the supervision of a trainer, so you can really make a difference and ensure that you don't get hypertension at the same age as your parents. So there is a lot that you can do. It's not like you don't have to submit to it and then say, yes, I'm definitely going to get hypertension.
Correct, sir. So I think looking at all the aspects are the key feature in this, to look things early and then manage it early. Thank you so much, sir. It was very insightful session on the hypertension. It was wonderful session. Thank you so much.
Thank you for having me today. Hopefully we managed to bust some myths for the patients, and it should help them. Thank you.
So the message is, hypertension is not just a number. It's a signal from your body. With guided rehab, medical supervision, and daily small discipline, your heart can truly recover.